Hi, my name is Rhea, and I'm from Cupertino, California. With the help of my mentor, Rebecca, I wrote a research paper on Clubfoot, covering its genetic causes, diagnosis, and treatment. To start off, I wanted to talk a little bit about why I chose to research Clubfoot. This is a condition I had as a child, and I'm so grateful to my parents and doctors for helping to have it corrected early in my life. I've always been really interested in the condition, and I thought that Polygence was a great opportunity to learn more about that. Throughout this presentation, you'll see that a lot of my images are from my childhood, and I really wanted to use elements of my own treatment journey to make this presentation more personal. Clubfoot isn't super well known, so I wanted to start by introducing what it is. It's a genetic deformity that affects the feet, causing it to turn inwards and downwards. There are three main types: idiopathic, which is most of the time, neurogenic, which means it's connected to an underlying neurological condition, and syndromic, which is when it's connected to a larger syndrome. In the picture on the right, you can see that the leg on the left is the clubfoot. Next, I want to talk a little bit about the diagnosis process. So clubfoot is detected through a physical examination, and it's really important to detect it as soon as possible to ensure that a treatment plan is in place. It can also be detected through ultrasounds at around 13 to 16 weeks, but given the high false positive rate, the only way to know for sure is to wait until the baby is born. I also proposed a way for underdeveloped countries to implement DNA testing for specific genetic mutations, which I'll be covering next. So moving on to the genetic factors, I did a lot of research going through a bunch of papers to find and identify different genetic mutations that have proven to cause issues related to clubfoot. For example, the deletion of FNLB leads to bone development issues. Additionally, PITX1 deletions can cause abnormalities in limb development. Without TBX4, there wouldn't be division of similar cells in the Achilles tendon. And STL5 is a deletion mutation that is expressed in the hind limb, causing it to be shorter. Finally, I want to talk a little bit about the treatment process. So the main standard of care is the Ponseti method, which I will be going through step by step, which was created and developed by Dr. Ignacio Ponseti at the University of Iowa. Additionally, I'm also talking a little bit about the Botox method for treating clubfoot, which is still in the process of being developed. So going into the Ponseti method, the first step is to conduct a physical examination, identifying the head of the talus, which is in the ankle, and seeing if it's deformed can help diagnose clubfoot. The second step is to cast. An above the knee cast can help manipulate the foot back into place, and that's typically a 6 to 8 week process depending on the severity of clubfoot. Step 3 is the tenotomy, which is seen in most cases. In the picture here, you can see that a small incision is made in the Achilles tendon to allow it to grow and lengthen. This helps improve flexibility in the ankle. The final step is bracing, which requires the patient to wear a brace, or in my case, a special type of shoe, for approximately 3 months to ensure that the clubfoot stays in its normal position and does not relapse. Relapse is when the foot goes back to its clubfoot state, and that Ponseti method has proven to eliminate the possibility of this happening. Just to sum up my project, I discussed the genetic causes, diagnosis, and treatment of clubfoot, a genetic disorder causing the feet to turn inwards and downwards. Additionally, in my paper, I proposed implementing DNA testing in countries and regions where clubfoot is more prevalent. Thank you.